Desert Orthopedics, essentially we want to make it so that all the services they may require is as much as possible under one roof. A lot of orthopedic treatments are geared towards non-operative treatment. Some of those includes things like injections or getting x-rays, getting a cast put on, having some sort of a brace product given to them, or may involve some medications like anti-inflammatory medications amongst other things that they may require. When patients come here and they need their medications, we would be able to provide those medications to them before they were to actually leave Desert Orthopedics, so they would not have to stop at other pharmacies. At Desert Orthopedics, we think the patient's time is very valuable. We want to make sure that we analyze with metrics to make sure that we're not keeping our patients waiting, and we try to get their visit expedited as much as possible. They have other places to be. Towards that end, we have metrics. We measure phone calls, how quick our responses are, how quickly we're responding to voice messages. We also time the fact from when they step through the Desert Orthopedics and leaving Desert Orthopedics. We want to make sure we minimize that time. We mentioned all the services that we provide under one roof, including getting our x-rays done, injections under x-rays, getting a cast put on, getting a brace put on, pharmacy products being dispensed. All those products need to be done in a certain time frame so that everybody can leave, and they can leave in a reasonable time frame. One of our longest numbers that I've heard, we do weekly measures, and longest I've heard is 38 minutes from the minute that they entered to when they left. We're always innovating, trying to get better and faster and more efficient. So we want to make sure that we do a good job for our patients, and I think it's reflected in our reviews.